Importantly, this session is to help you learn some basics of ultrasound. It is not a comprehensive anatomy session. I want you to look at the videos and get a sense of what images look like, how to describe the images, and just some basics like this is what muscle looks like, or this is what vessels look like, or this is how bone makes the ultrasound shadow. Why should you care about ultrasound? Now, wouldn't it be amazing if you had a device you could just take into the patient's room that would give you a window into their anatomical and pathological state? I'm not talking about the stethoscope. I'm talking about if your stethoscope got into a terrible accident, and got chemicals spilled all over it, and mutated into this amazing device that allowed you to actually see inside the patient, to give you a real idea of what's going on, to give you information before the CAT scan comes back, before the labs come back, to allow you to make clinical decisions that will make differences for your patients, save lives. Now, these devices are not only going to make you great physicians, but they're going to make you great medical students because it allows you to tie in everything, anatomy, physiology, pathology, into a single learning session. And it's going to build skills that you're going to use for the rest of your careers. We want to elevate you from Joe Blow medical student to the medical probe-wielding ninja that every residency is going to want. First, what is this mystery machine? What is this black mystery box that can allow us to do all these amazing things? And yes, that is the Raiders of the Lost Ark from Indiana Jones. Basically, the ultrasound's made out of two major parts. There's the computer part, which you can hold in your hand or that we put on a stand that we wheel around the department or the clinic. That computer is attached to a cord, which is attached to a transducer or a probe. The transducer is lined with piezoelectric crystals. These are literally small crystals at the end of the transducer. An electrical current is applied to the crystals and they vibrate at very high frequencies. Frequencies so high that they're not audible, therefore they're called ultrasound. We apply the transducer to a medium such as the human body. Waves go into the body and some of them get bounced back to the transducer. These same crystals and electrical equipment record all these bounce back waves. They send it up to the computer. The computer interprets these and puts the image that it interprets up on the screen, and that's what you're seeing as an ultrasound image. Now, when we first learn medicine, we like to think that all tests are perfect, all diagnostics are perfect, but that's not the case. The same is true with ultrasound. When we apply ultrasound, the waves don't always bounce back. They can be refracted, they can be scattered, they can be absorbed, which can cause heat. And all this can create artifacts, it can create an imperfect image. And it is our job to interpret the image so that we can make a correct diagnosis. Let's take this real ultrasound image as an example. Now, there's vessels in the middle here. This is the carotid artery, this is the internal jugular vein. Within them, there's blood, and the ultrasound waves pass right through them. These structures are anechoic. They have no echoes. Now, there's muscle on top and fascia below. The muscle is hypoechoic, and the fascia is hyperechoic as compared to the other tissue around it. If the tissue is darker compared to the surrounding tissue, we call it hypoechoic. If it's brighter than the surrounding tissue, we call it hyperechoic. And if there's no echoes within it, then that is anechoic, or without echoes. In this example of fetus, the amniotic fluid is anechoic. The skull, the bone, is hyperechoic, and the brain within is hypoechoic compared to the skull. There are many types of transducers, and we are only going to talk about the linear or high-frequency transducer because that's what we use for superficial tissue, such as evaluating the arm. The linear transducer, or high frequency, is good for looking at detail superficially. One of the main challenges with ultrasound is that you're imaging three-dimensional structures with a two-dimensional device. You want to think of the ultrasound probe as a flashlight, but you're only getting a slice out of the human body, kind of like an MRI or a CT slice. And we describe these slices as either in the longitudinal plane, which is usually sagittal, or the transverse or the short plane. And we usually image everything at least in two views, long and short, or longitudinal and transverse, because otherwise it's difficult to understand what this three-dimensional structure is actually looking like. When describing how you're imaging someone, the planes of the body are also commonly used. There are many knobs on the ultrasound machine that you will learn over time. However, for now, for simplification, let's learn about two of the most important ones. The first one to talk about is gain. Think of gain as brightness, how you make the image dark or light. Let's take an example here. This is the right upper quadrant. We have the liver. This is the IVC here, a little bit of gallbladder, diaphragm below. And we're turning the image, turning the gain up and down, making the image brighter, then darker, then brighter, then darker. And that changes how we see it. Now, if you turn the gain up too much, you make the image too bright, like this one, you lose differentiation between the liver, kidney. You can't really see the blood vessels. And then if you make it too dark or too little gain, you also lose a lot, and you just can't see differentiation between those organs. Depth is the second one we need to talk about. If you care about what's on the top of the screen, the liver, kidney here, you have all this wasted real estate below, you don't have a good picture of what you care about. And if you create the depth too small, then this is too close to the screen and you lose some important anatomy below. Now let's move into some anatomy. First, we're going to start at the neck. And you're going to see several things. We're just going to concentrate on some basics. You'll see the carotid artery, internal jugular vein, the sternocleidomastoid muscle, as well as some other muscles of the neck. We'll see the thyroid, the trachea, and the vocal cords as well. And then we're going to move inferior in the body, and we'll go over the clavicle. We'll get to the pectoralis major, and we're going to see some lung pleura with lung sliding. Then we'll continue on to the upper extremity. We'll first get to the shoulder, where you'll see the humeral head. You'll see the greater and lesser tubercle of the humeral head, as well as the insertion of the subscapularis muscle. We'll move down to the upper extremity. We'll see deltoid muscle, bicep muscles, brachioradialis, the flexors of the forearm, as well as pronator teres. And you'll see several vessels along the way, including the brachial vessels. We'll move all the way down so you can see the radial and ulnar arteries. And we'll see several nerves, including the radial nerve, ulnar nerve, the median nerve of the forearm, as well as some nerves in the upper arm. We begin in the upper neck. In the center of the screen, you can see the carotid bifurcation. The arteries pulsate in the middle. Just on the left of the artery, you can see the internal jugular ballooning up as a patient valsalvus. We compress with the probe and see that the vein fully compresses. Just anterior to that, or on the top of the screen, is the hypoechoic sternocleidomastoid muscle. When color is applied, you can easily visualize the carotid artery. Now let's switch to the long axis. Now we're seeing the carotid artery pulsate in a long axis that's up and down in the body. Below, you can see some tracheal rings, which are bright, hyperechoic, and some shadowing below them. Next, I will apply some color so you can better visualize the carotid artery in the long axis. Notice how it pulsates, and again, notice the cricoid cartilage and the tracheal rings. There's a little bit of thyroid inner image. Let's take a better look at the thyroid as well as the trachea. So let's travel back up to the proximal neck, or back at the carotid bifurcation. You can see the carotid artery pulsating in the middle, the sternocleidomastoid muscle, anterior in the image. We're starting to get thyroid. There, it's in the middle of the screen. You can see a little bit of the trachea as well, which is on the very right of the image. I can see bright tracheal rings at the top of the image, and then a lot of shadowing. That's all that darkness. Now we're getting to the level of the vocal cords. Remaining in the transverse axis, I'm going to shoot right in between those tracheal rings and have the patient do some E's and O's. That motion you're seeing right in the middle of the screen, that's the patient's vocal cords moving. Then we're going to move to a long axis. There's some tracheal rings again, and now the indicators point towards the patient's head. And that real bright line, that's actually the trachea. And it looks so bright because just below it is just air within the trachea. Switching back to the transverse axis, we're going to look at the left lobe of the thyroid gland. Now again, you can see the carotid artery pulsating right next to the thyroid gland. And unknown to this patient, they had a simple thyroid cyst, which you can see here as an anechoic structure within the left lobe of the thyroid gland. Now let's explore more of the upper extremity as well as a little bit of the chest and lung. So we're going to go back to what you know, back to the proximal neck. And here the carotid artery again pulsating in the middle of our screen, the sternocleidomastoid muscle anterior. And there's our internal jugular vein, easily compressed once again. Now we're going to travel down to where the thyroid is, which we've already seen, some trachea on the right side of the screen. But this time we're going to continue down. We're going to follow that carotid artery all the way down to the subclavian veins and the innominate vessels. And there you see them as anechoic structures in the middle of the screen. we keep traveling inferiorly, we're going to get to the clavicle, which totally shadows our image. Bright on top, shadow on below. We roll right over it, and now we have pectoralis muscle and lung pleura underneath. More specifically, this is visceral and parietal pleura sliding on itself. So as the patient breathes in and out, you can actually see that bright line moving back and forth. So it's actually the lung physically moving back and forth as the patient breathes. And in this way, clinically, we can rule out a pneumothorax in the patient. Let's move even more anteriorly, and we can really get a sense of this pectoralis muscle. So this is a large muscle in the body, and it takes up nearly the entire screen as we remain superficial in the image. Now we shift lateral to the shoulder joint. We're having the patient move his shoulder with internal and external rotation, and you can get a great sense of the humeral head, the lesser and greater tubercles, and even the insertion of the subscapularis muscle. Now as we travel distal in the arm, you'll see humerus below, which is bright and shadows. You see biceps muscle on top, triceps on the bottom, a little bit of deltoid as well. There are brachial vessels that sit in the middle of the bicep and tricep, which is the big arrow. The small arrow is the median nerve. Let's continue down to the antecubital fossa. As we go down, you see bright bone underneath, that's the humerus, and biceps on top. As we travel down the antecubital fossa, you can see some overlapping of the brachioradialis muscle with the biceps and a little bit of the proximal radius. If we switch from a transverse axis to a long axis of the muscle, you can really appreciate the striated nature of these muscle fibers. And when we move to the level of the brachioradialis and the pronator teres, while the patient pronate and supinate, you can see the alternating contraction of these muscles. Jumping to the distal lateral arm, appreciate the radial artery just sitting right above the radius, which is bright in shadows, and the radial nerve, which looks like a bundle of hyper and hypoechoic nerve fibers. This is in a transverse plane. And then we will jump over to the medial aspect of the distal arm. The ulna is underneath, bright with shadow, and the ulnar artery sits atop, pulsating. The ulnar nerve is right next to it, and as we become more proximal in the arm, you can more appreciate both the median nerve as well as the ulnar nerve. As you can see, the radial and ulnar nerves typically run with the radial and ulnar arteries. Now that's going to be it for now. We've done about 15 minutes, and I don't want to overload any people. So I hope you got a sense of what ultrasound is, how the ultrasound machine works, some basic understanding of how to describe an ultrasound as hypoechoic, hyperechoic, or anechoic, and in relation to the planes of the body, as well as the long and short axis of the ultrasound transducer. And we talked a little bit about the physics, as well as a couple of the important knobs, which is gain and depth. I hope you're just starting to get a sense of how ultrasound can really incorporate everything you're going to learn in medical school and what you're going to need as a doctor. Anatomy, physiology, pathology, as well as go far to diagnose and treat your patients. Now, I do apologize if the audio quality is not the best. We have a huge tech upgrade that will be coming shortly, and we have a huge amount of future content that we're just waiting to release. So please stay tuned and look forward to that. In addition, there's many events through the Ultrasound Interest Group that are coming up on the horizon. We have a few events that we're planning ourselves, so there are great things, life-changing events that you're going to want to be a part of. So let's get involved with your Ultrasound Interest Group. If you want to do some content for the website or do some ultrasound teaching or more learning, please let us know, and please contact your interest group and we can get you involved. This is going to be a student-run website, and we want the majority of content coming from you.